Hello everyone, I'm Dr. Smita Parakh. I'm working as a consultant in Department of Liver Transplantation, HPB and Surgical Gastroenterology. Living donor liver transplantation entails removal of part of the healthy liver of the donor and it's transferred to the recipient after removal of the deceased organ. The procedure is made possible by the fact that any person's body needs only about 20 to 30% of the existing liver to do its daily functions and the liver's unique property to regenerate. After transplantation, the partial livers of both donor as well as recipient will grow and remodel to almost its original size in about 3 months. A donor may be anybody from the family or blood relative, generally a parent, an adult sibling more than 18 years of age, or an adult child who has to be more than 18 years of age, or somebody who's emotionally close, such as a spouse, who volunteers to donate part of his organ after being explained the risks involved with the surgery. The principal advantage of LDLT is that it makes an organ available for a patient on an immediate basis. The timing of liver transplantation can be planned and the progression of liver disease and its complications can be avoided in the patient. Liver transplant is a major surgical procedure requiring about 10 to 18 hours. After transplantation, a patient requires intensive care treatment for about 5 to 7 days, following which he requires hospital stay for another 10 to 14 days, making an average post-operative hospital stay of 14 to 21 days. During the entire hospital stay, an intensive monitoring of liver, heart and kidney function is done. Subsequent to discharge, patient needs to be on follow-up on a regular basis. The period of follow-up gradually increases over time. Patient needs to be clinically examined by the doctor and needs laboratory investigations to curtail the immunosuppressive or anti-rejection medications which we put the patients on post liver transplantation. The success rate after liver transplantation is around 90% at the end of 1 year and is around 75% at the end of 5 years. It means that 75% of the patients who undergo liver transplantation will live beyond 5 years and more than 90% of patients who undergo liver transplantation tend to live beyond 1 year of age. If you compare this with the operation for major cancers or other transplantation, this is an exceptionally good result. It is particularly so given that without a liver transplantation, most patients would have died within a year. Liver transplantation is an extremely difficult operation requiring multidisciplinary teams to handle pre-operative, intraoperative and post-operative care. We at Noble Hospital have a comprehensive liver care team available 24/7 to handle such patients.